Hey everybody, I just wanted to drop a quick line. It's been a little while since I've started or had one of these. It's been about a month, so I thought maybe we could just kind of briefly talk about hormones for a bit. Since I've opened my new practice up in northern Austin, I've been seeing a lot of E-share patients, obviously, but about half of my practice now is just basically hormonal imbalance. And I've been doing that for years, but I haven't really focused on hormones as a group. And now I'm able to see women from across the country that have hormonal imbalances because I can use Chiron telemedicine visits and actually bill insurance. So it's actually kind of a cool thing. And I just wanted to come online and talk real quick about those visits or even a visit in the office. And what we check, or what I check during these visits for hormonal imbalance: estrogen, progesterone, free and total testosterone, DHEA, vitamin D. We can also check cortisol, melatonin, and metabolites if we use urine. But let's say we want to just use your insurance, then usually I'll use blood tests at that point in time. So basically, we get blood tests, usually covered by the insurance, get the results back the next day, and basically based on whatever the imbalance is, and we can go over things like that too, but one of the main questions is, how do I know if I have a hormone imbalance? I mean, why would you think I have a hormone imbalance? I think any woman who, at least, this is my distillation of, 40,000 women talking about, hormones, how they feel. So this isn't coming from me as a man, like what would I know, right? This comes from me sitting with 40,000 women over the last 18 years and, coming up with these plans and these protocols. So women that come in for hormonal imbalance are basically looking at things like not sleeping, mood swings, irritability, breast tenderness, irregular periods, water retention, achy joints, headaches, and everybody can say, well, everybody has those. And usually that's true. You could have any of those at any time. But the point is if you have these to the point where it's interfering with your life and the way that you want to live your life, then it's probably a good time to come in and get your hormones checked. And hormone imbalance can happen at any stage of life. Younger women can have progesterone deficiencies. Midlife women can have progesterone, estrogen, and testosterone deficiencies. Older women tend to have, rather than an imbalance, it would be more like they're not making any hormones, and that's a whole different ball of wax altogether. So by going to the website, www.Shawn Tassone, so DrShawnTassone.com, you can make an office appointment where you come see me just online, and you can also call Jenny at 512-956-0296, and she can set you up with a Chiron online appointment where we'll connect face-to-face through the internet and go over your medical history, surgical history, and things like that. And then I'll order labs from a lab that's close to you. And then we'll talk about the imbalances when I get those results and what I think might help you start feeling a little bit better. So anybody have any questions? I know there's only currently 7 people online, but if you have any questions, feel free to ask now. If you're catching this when it's not live, then by all means, I will do my best to answer those offline. Jenny just posted the number through my gorgeous face there, so she's trying to help me out with this one. I'm actually in the office today, and I've seen probably 6 or 8 women today that have hormonal imbalances. These are ranging from a young girl in her 20s to a 60-year-old and everyone in between, and all the imbalances are different. Over the last 20 years, I've taken in probably 30,000, 35,000 women and talked about hormone imbalances. I have women coming from around the country. I see women from around the country. So yes, I do take insurance. I can bill the insurance companies that are out of state for the office visit. If they don't cover, then obviously that would be a billed visit. But I haven't really seen that that's been a huge problem yet. But I mean, it could be, but usually because it's a code that they recognize. It's a diagnosis code they recognize. It's usually not a problem. So, like I was saying, young women, 25, 35 and up, obviously, testosterone deficiency can be a huge problem. You know, women with testosterone deficiency tend to hit the wall at around 2 to 3 in the afternoon, tired, lethargic, possibly to have, they might have decreased libido and other issues. Obviously, libido isn't all just testosterone, but that's certainly a part of it. Progesterone deficiency, those women tend to have insomnia. They might have breast tenderness, recurrent history of recurrent miscarriages, estrogen, excess of estrogen. I would say the number one hormone imbalance of the 12 that I've recognized is going to be estrogen dominance. And while a lot of doctors may not think that estrogen dominance is a recognizable disease, and it's not technically something that we can code for, but women can have too much estrogen. And whenever I have a doctor that says to me, oh, estrogen dominance isn't a real thing, I just ask them, well, if you have a woman whose estrogen is super high, what do you call that? You have to call it something. And so we call it estrogen dominance. And, you know, that's a very common in this society because we take birth control pills. You know, women, we eat foods that have hormones, and we drink out of plastics that can leach bisphosphonates and other chemicals that can stimulate estrogen in the body. Sometimes we're eating too many phytoestrogens in the diet, like soy and whatnot, and that can cause an estrogen dominance. Sometimes the estrogen dominance just gets out of hand and can really make you feel awful. And so it's good because we can lower estrogen using plant-based medicines like diindolylmethane, which is, you find it in broccoli and Brussels sprouts. We can also help bring up the progesterone levels, which might help a lot too. Where are the changes that can happen with hormones after having a tubal ligation? You know, Candy, that's a really interesting question, and something that you've probably seen is somewhat controversial with physicians, right? So we often wonder, you know, they call it in medicine, they call it post-tubal syndrome, and whether or not it's recognized by some doctors, you know, it's obviously their prerogative. I can tell you that I don't ever write things off, and I have seen women that have said, ever since I had my tubal, my periods have been off, or I've felt this, or I felt that. Whether or not that's a blood flow issue from the ligation, which most doctors would probably say it's not, because most of the blood flow comes from the other side of the ovary, which is not being interrupted. But I've seen it enough, and I would say if you're having hormonal issues, whether or not it's related to the tubal, I don't suppose is of utmost importance. It's really fixing it. So you could actually fix it hormonally. You could fix it through nutrition. You could fix it through supplementation, as well as other things, and you can possibly fix it with the tubal reversal. I'm not sure that there's a lot of data that shows that, and tubal reversals tend to be very expensive. You know, you're talking $7,000. So is HGH good? So my theory on HGH, one is that it's super expensive. It's probably going to cost you about $1,200 a month. If you have if you start taking HGH, it makes things grow. It makes things, that's why it's called growth hormone. So if you have a cancer cell in your breast, say, and you give growth hormone to a patient, does it make that cancer cell grow faster? And I don't think we really know the answer to that, but it's just something that you need to think about. But usually I don't use it simply because of cost. Do C-sections affect hormones? I can't think of a physiologic reason why C-sections would affect hormones. Now, being a mother can affect your hormones, and then the postpartum period can certainly affect your hormones. They're going to fluctuate, and that's one of the reasons I think that we have a risk for postpartum depression, is because of the swinging of the hormones. Is it directly related to the C-section? If you think of the C-section as just being the incision on the uterus, that technical piece, no, but you know, the stress of the C-section on your body, the stress of being a mom, yeah, that could definitely affect things indirectly. Christine, how long after my histo, leaving the ovaries and removing my Esher, should I have my hormones rechecked? I like to recheck hormones for two things. One would be if you're doing great, once a year. If you're not doing great, then you call when you're having the issues, and I would check your hormones then. If you're somebody that I'm just starting out on hormones, I usually like to check or talk to you in about 8 weeks to see how you're doing, and then I make the judgment from there. So everybody's a little bit different. And the thing about the hormones that I prefer is I like to use the bioidentical compounded hormones. I've been using them for, 10 to 12 years. I was using them when they were considered crazy, and now most physicians will prescribe them, and there's a clinic popping up on every corner. The other thing I wanted to tell you regarding clinics on every corner, you should never ever have to pay for a doctor's visit to go see somebody about your hormones. You don't have to spend $500 to go to a hormone clinic when there's people like me out there that bill insurance. This should be something that should be covered by your insurance. The prescription might not be, but you're talking maybe $45 a month for the prescription. And a doctor shouldn't be charging you that much to review your hormones. And blood, if they're contracted with your lab, which most doctors are, the lab will be covered by your insurance. So I've seen women walk out of a physician's office paying $800-900, and sorry about that, I got a phone call. And they're having to shell out all this money, and they're not feeling any better. Well, I'm not saying that I'm perfect by any stretch of the imagination, but I do have a ton of success with this, and I've had a lot of experience. So why not use somebody like myself or another, gynecologist that's out there that will bill your insurance and will also help you find out what's going on. And it's interesting. There are a lot of us out there. I know it's hard to find people sometimes because most doctors are super busy, and to sit down and talk with somebody for 30 minutes about their hormones is somewhat difficult at times. But I do that. I'll sit with you for 20 or 30 minutes. And usually I tell patients, if you can stick with me for 2 or 3 visits, we'll usually figure this out. We'll usually get things back into balance, because it may not happen the first time around. It may be somewhat difficult, and by the time I get some patients, they've already seen 4 doctors, and they've tried 4 different things. And so consistency is super important. I know we all want the quick fix because we don't feel good. I know we all want to feel better as soon as possible, but sometimes sticking with one person so that they know your data, they know your data points with your labs, can help a lot more. Can you get hormonal changes after a histo leaving the ovaries? Yes. That's a different thing than a tubal, because you are interrupting blood flow to the ovaries. Now, theoretically, the ovaries should pick back up and they should make the same amount of hormones eventually. But you could have a dip for sure in the first few weeks after having a hysterectomy, and you could have things like hot flashes, mood swings, irritability, vaginal dryness, insomnia, and things like that. So it is important to keep an eye on that, especially if a few weeks after the surgery those symptoms aren't changing. Hello, Christy. I wouldn't necessarily go as far as saying hero, but I do appreciate that. Thanks. Hey, Trish. It's nice to have Trish here. Hopefully I'm going to see Trish in a couple of days. We're going to a wellness conference out in San Diego, so I look forward to that. And actually I'm going to be running a hormone table at one of the lunches, so that'll be fun, teaching or talking to other alternative care providers about hormones, and trying to educate each other and ourselves about how things change. So and I'm hoping that by her hands and that star and those hearts that means Trisha's going, because I'll get to finally meet her in person and be able to introduce you to my wife, because she's going too. So that'll be cool. Anybody else have any questions about hormones, hormone appointments, insurance coverage, what I see? Well, Christy, thank you. And part of that is I'm grateful that I was able to help. I'm sad that you had to wait as long as you did to get things figured out. Yeah, well, you can fly me out to Sweden. I'd be more than happy to come out there and, hang out with you guys. I'm not real good at the language, but, you could be my interpreter, Pia, and we'll go from there. I mean, I'm only more than willing to come out to Sweden. Who wouldn't be, right? So let's see, what other things are common? Testosterone deficiency. Women come in all the time with a decreased libido. It's common, affects all age groups. The thing that I want women to understand about testosterone deficiency is it isn't just testosterone that drives sex drive for women. It's stress levels, it's sleep, it's kids getting in the way, it's how much of a jerk your partner's being. I mean, there's a lot of things. So we could fix your testosterone, but it doesn't necessarily mean that that's going to ultimately fix your sex drive. And usually what happens is your testosterone level going up increases your energy levels, which indirectly can then affect your libido. Somebody asked a question back here, 2 years postpartum, feeling semi-crazy. Could there be postpartum still? That wouldn't be postpartum anymore. So if you have depression or hormonal imbalances, that's not coming from being in the postpartum period. That's kind of like tongue-in-cheek with the women that say, I never lost my baby fat. 2 years later, that's not baby fat anymore. That's just, fat. I would say if you're still having issues 2 years postpartum, then, if you're having depression issues or something, you probably want to talk to some healthcare provider or mental health care provider that can help better with that. Yeah, if it's postpartum depression, you either want to go talk to your primary care doc or a mental health provider in your area that can help you through that better. So, hi, Elizabeth. Nice to have you on board. What other questions? Let's see. We've got progesterone, estrogen, testosterone, other things, cortisol and melatonin. So cortisol and melatonin can be checked, but it has to be done through a urine test rather than blood tests. Cortisol can be checked through saliva as well, but you're going to be paying out of pocket usually for a good cortisol test. And cortisol is kind of that hormone that's made by the adrenal glands that kind of helps you deal with stress better. It's a hormone that I see elevated quite a bit in women that have highly stressful lives, whether it's work or home. They're super stressed, and I kind of liken elevated cortisol to kind of burning a candle, but instead of using a match, you're lighting it with a blowtorch. So you're obviously kind of running through things quite a bit faster, and that can affect your hormonal balance. Melatonin, if you're low in melatonin and you're not sleeping well, then not sleeping well is going to be causing some hormone imbalance. What are the biggest indicators of hormone imbalance? Christine, I can tell you what I see. Insomnia is really common in women. Irregular periods, weight gain is very common. Breast tenderness, nipple tenderness, are probably the big ones that we see. Just a kind of a generalized feeling of headaches all the time, not feeling like yourself, feeling like you're retaining water. There are also some smaller ones too that don't happen to everybody, but are definitely signs. Decreased libido being one. I see that a lot, probably daily. See decreased libido. Progesterone deficiency causes the insomnia. See that daily. I can't tell you. I maybe have seen one patient in the last week who's actually said that she doesn't have a problem with sleep. So that's a common one. That's probably our society and the way that we live our lives, and looking at our phones in bed and working 24/7 basically. So I'm on estradiol. I would love to find something natural that's effective. So what I would recommend if you are trying to balance your hormones and you are on hormones or you're not on hormones and you want to try something natural, the product that I recommend is maca. The thing with maca is there's 13 different phenotypes or types of maca, and most of the maca that you can buy over the counter now is going to be ground up powder. And the problem is you never know what you're getting in the powder. There's certain maca blends that are better for men. There's certain maca blends that are better for women in menopause or perimenopause, or women that are wanting to have babies. So what you want to do is go to a website, www.maca, www.feminescence.net, and I'm going to see if Jenny can spell it. www.feminescence.net, and it has all the different maca products on there. Feminescence is made by a company that really has strict adherence to the different types of maca and the balances that you need to have of different types for certain disorders. $35 to $40 a month, and most women that I put on that seem to have some really great symptom resolution. Would you recommend using birth control just to balance hormones after histo leaving ovaries for issue removal if the compounds don't seem to work? I'm not a huge fan of putting women on birth control pills, only because if you look at the amounts of estrogen that come in those and progesterones, first of all, they're synthetic. So how's your body going to respond to those? And secondarily, they're about 7 times higher than what we would give you for a simple hormone replacement. What I would probably prefer in somebody like that, Kim, would be to come back to the doctor that gave you that, whether it's me or somebody else, tell them that you're still having symptoms, redraw your labs, and then change your dosage, because you might need more, especially if you're younger, and by your picture you certainly do look younger. So Ashley Verhalen, again, thank you very much. My Tucson connection, delivered her baby, gosh, got to be going on, what, 3-4 years ago now? And it's actually feminescence.net, not com. That can get you there too, but I usually use the net. But 5 years, wow, that's a long time. Didn't realize that. So yeah, again, if you're doing hormone therapy and you're not feeling like you want to feel after about 4 to 6 weeks, then you should redraw your blood and see where you're at with the dosage you're on. It might be, we don't put you on super mega doses, so it might just be that it's not enough, or it didn't quite bring things into balance. So checking again, we can change the dose. How much will it cost to get the tubes removed, since the e-sure is still in my tubes because I don't have insurance? Off topic, but let's answer the question. If it's a cash pay deal because you don't have insurance, my hospital has a deal for e-sure patients just because so many women have been coming here. It's probably with surgeon, hospital, and anesthesia, you're probably looking at around $7,500, give or take. Yeah, Kim, just shoot me an email, call Kim, call Jenny. We can set up an online appointment, and I can ship those labs while we're talking right over to a lab close to you, and you can just get the blood drawn, and we'll change your dosage around. No sense in suffering. No problem. What other questions do we have? Hormone questions. We've got about 27 people here. That's like a record. All here to listen to me chatter on about stuff. Do you have any questions about any other topics? Fibroids, e-sure, other hormone issues? Here's one of the things that I think is stemming or pushing along the decreased libido thing. About 10 years ago, what came out was Viagra, right? The blue pill. And so you had all these couples that had been married for 15, 20 years that were having decreased amounts of sex, but they were fine, right? Because both of the partners were fine with it. Then you start having men getting erections all weekend long, and they're wanting sex. And so now the women who are all of a sudden feeling like they need to have sex more, but they're not interested, just like the husband was a week ago. And then you have men all jacked up on testosterone because all these testosterone clinics are popping up around the country. And you have men with erections that now have high testosterone levels like they did when they're 25, but women are the same. They're still 45 or 50, and they've got other things to do. So that is causing this discrepancy in sex drive, I think, for women. It doesn't necessarily mean that there's something wrong with you. You want to just look at your husband and see if maybe, things have changed with him, and that's kind of what's spurring this conversation. Will vitamin D deficiency cause the same issues as low progesterone? Vitamin D deficiency is one of those silent things. So probably 9 out of 10 women that I draw vitamin D on are low. And that's fairly consistent with the country, the problems that we have in the country with vitamin D levels. It doesn't cause, it shouldn't cause symptoms per se, especially like progesterone deficiency would. It's going to be more of a, a silent thing like an increased risk of heart disease or, increased risk of colon cancer that's correlated, not necessarily causal, but you just want to, keep an eye on vitamin D because it is one of those things that you might not know that you have a decreased level of. All right, we're pushing 30. We keep going to 30, then we come down to 29. Let's see if we can break 30. What other questions? What other things can we think about to talk about in the next few minutes? Tuesday afternoon. I'm going to try doing these Facebook Lives a little more frequently so we can get some people asking questions that, maybe you couldn't ask before. And obviously, I would put this disclaimer in that this isn't something that I'm telling you medical advice. Obviously, I can't substitute for your doctor unless I am your doctor. But if I'm not your doctor, I would encourage you to talk with your doctor about these things. Or if you want to talk to me, you certainly can online, or you can come to the office. Jenny's posted the phone number for visits. You can also make appointments online at www.drshawntassone.com. You can, most insurances now are accepted. I'm still trying to get on First Health and some of the other small ones, but most of the large ones now are being covered. It's 11:30 p.m. in Sweden. Hubby and I are watching you in bed. Well, I'm not Johnny Carson, but thank you. I don't think I've ever been told that before, so that's kind of interesting. Jeff Kent joined. Jeff Kent wants to talk about hormones. I went to junior high and high school with Jeff Kent, so he needs to learn a little bit about hormones. Do you need them anymore? Do you need what anymore? Hormones? I guess I don't understand the question. By the way, Jeff, if you're still watching, which I think you are, tell your mom I love her and I hope that she's doing okay. And I hope you're doing okay. You can't really test oxytocin levels, Lorena, because oxytocin's half-life is about 8 minutes. So you lose it too fast for us to really test it. There are some studies that do that, but it's very hard to do, and it's not something that I would put a lot of credence in right now because it's relatively new. Any help advice for irregular cycles, women that can't take birth control? Again, depends on why you're having them. Thyroid issues, fibroid issues, hormonal imbalance issues. You really have to get to the root cause to really give you, thanks Jeff, appreciate that, to really give you a good answer to that question. You did my C-section for Mason in 2015. You're the real MVP. Thank you, Paige. Very, very nice. Have you noticed in common hormonal abnormalities in your patients where you also found endometriosis? And if so, what should we be looking for? Yes. So endometriosis is usually found in women that have higher levels of estrogen or potentially lower levels of progesterone. We don't know exactly what causes endometriosis. Is it a genetic component? Is there some sort of anatomical component, hormonal component? Is it a combination of these things? But correlatively, we see estrogen levels that are higher because endometriosis obviously grows under the stimulation of estrogen. We also know that women who have endometriosis that become pregnant tend to have endometriosis that kind of goes away. And it may go away forever, it may go away for years. And it's because of the gestational effect of the progesterone on the endometriosis that it's a blocker, it's an estrogen blocker, and it blocks the cells so that the endometriosis usually will resolve. So the question being is, if you have endometriosis, you're probably going to want to look for an estrogen dominant situation, and you're probably going to want to look at a possible progesterone deficiency as well. I don't even know what time it is because I can't see my phone, because I'm on my phone. If anybody's got any more questions, let's see. I had a partial hist to do intense boot camp when using heavier weight and jumping with the ring down. I need to urinate way more without weights. So are you needing to urinate or are you leaking? If you're leaking, that's probably an anatomical defect. what's called stress incontinence. If you're leaking because you're bouncing up and down and it's causing your bladder to spasm, that's called urge incontinence, and it's probably something that you might want to talk to a physician about, either doing a urine study on you to see if you have urge incontinence, or detrusor instability is what that's called. Detrusor instability can be fixed with medications most time. Stress incontinence can be fixed with pelvic floor rehab. You can see physical therapists now that will do that, and they can strengthen the muscles of the floor of the pelvis, but that could potentially make urge incontinence worse. So going to a gynecologist or a urologist that does urodynamics testing in their office would probably be a good first step for you to see what you need to do or what's going on. You want to diagnose it first. Again, just like hormonal imbalance, before you really want to prescribe a course of action, you want to figure out what the problem is. Hey, it's 4:33 p.m. Thanks, Jenny. Thanks, Christine. LaWanda said it was 4:35, so I'm not sure what to believe. It was 4:33, 4:35, 2 minutes prior to that, so I don't know. I'm all messed up now. Holly, thank you for the info. I didn't realize they did that. Of course they do that. We do everything, right? But that's what we're here for. We're here to help with those things. And urodynamics testing is fairly simple. It's covered by your insurance in most cases, and it really helps us narrow in on what the problem is. The office where I used to work does urodynamics testing. I don't do it now that I'm in a solo practice because the equipment's too expensive. But I could certainly get you set up with Dr. Lander, who's my wife, and she could set up the urodynamics testing if you're in the Austin area and you want to swing by. Otherwise, I would start with your gynecologist and see if they do it in the office, and if they don't, then they'll refer you to either a urogynecologist, which is a combination of a urologist and gynecologist, or they'll send you to a urologist that does it in the area. So we're going on about 30 minutes, 35 minutes. I don't know any good jokes right now. None that I could probably tell live. Thanks, Emily. I love hearing how wonderful my wife is when I'm doing a Facebook Live here. So, yes, my wife is awesome. Yes, she's beautiful. And yes, she's my equal, I would say. I was going to say she's better than me, but maybe at some things. Fort Worth, yeah, I have a friend that's in the Fort Worth area named Dr. Patrick Allen, Allen. He did residency a couple years behind me. He's a great guy. I don't know his number off the top of my head, but you might want to give him a call. He may do urodynamics testing. If not, he can definitely send you to somewhere that will do it. Any other things? Oh, the other thing with urine stress incontinence or urge incontinence is it can be related to hormones. So, if you're having a hormonal imbalance, it's kind of like another straw on the camel's back. So it might be, depending on your age and things like that. Also surgeries, things like that. But hormones can play a factor, like estrogen. Estrogen is good for the bladder and the vagina. So if you have low estrogen, it could make those tissues weaker, which could contribute to the leaking and could contribute to the spasming of the bladder. So you might want to look into having your hormones checked as well. What else? Weight gain? Anybody have weight gain? Anybody have weight loss? Probably not. So weight gain and weight loss. Weight gain can definitely be thyroid issues as weight loss. Weight gain, cortisol being too high, stressful environment, estrogen being too high, can help you maintain fat levels. It may not make you gain tons of weight, but it certainly can. Your estrogen may make the insulin levels dysfunctional in your body. I live in Atlanta. I was diagnosed with low estrogen today, and I was told, she's making me hang on. Low estrogen. First of all, I need to know what your age is too if you have low estrogen. Now keep in mind that as you cycle, so you're going to have low estrogen levels the first 5 days or so of your cycle because your ovaries are resting. You're going to have a high estrogen level in the middle of your cycle, and it's going to start decreasing in the second half of your cycle. So, or if you draw your hormones on day 21 of your cycle, your progesterone should be high. So it really, I actually have, I don't have her book, Natasha's book, but I have heard of it, and I've sent her an email and she didn't respond. I would like to talk to her. I think that diet does play a lot in hormonal balance. One, weight is a huge thing. Insulin resistance is a huge thing, which you can fix sometimes with diet and exercise and the things that you eat. I have to stay on estrogen for the rest of my life. I am 44. So what I'm gathering from your comment, Michelle, is that you probably have ovarian failure, like you're basically in menopause if that's the case. So that would be my guess, since I don't know your history. I'm going to take one more question, then I'm going to wrap things up. And if you want to continue talking to me, feel free. We can do this all day online. Well, not all day, but you get my point. I'd be more than happy to answer questions. It could just be, a visit to answer your questions, like Michelle asking about her estrogen and things like that, because maybe sometimes you don't have the time to spend with your doctor, and I do these visits on Mondays, so we can chat on Mondays. I think since there aren't any questions popping in, I'm going to finish for today. And I'm going to thank you guys for showing up, because I know it's in the middle of the day and it's probably time to go back to home from work, or you've got crazy kids that are, tearing the house up. I will be trying to do these now once a week, maybe more, if people have questions. I don't know any doctors in Northern California. Unfortunately, I'm sure there's tons. I just don't know any off the top of my head. So I'm going to end for now, and I'd like to thank everybody for showing up. Feel free to drop any questions in the boxes even after the live. Well, Holly, they do have the knowledge I have. They're probably just not as easy to talk to. I don't know. I mean, there are a lot of doctors that know it, but maybe not where you live. And like I said, I'd be more than happy to talk to you. Yeah, you're welcome, Pia, and we'll check in with everybody. Yeah, Pat Allen, Dr. Pat Allen. He's in Fort Worth. So look him up. I don't know off the top of my head, but Patrick Allen is his name. He's a great guy, stand-up guy, really smart, and I've known him for a long time. So take care, and I'll see you guys on the net.